Omaha's news leader, chronicling the stories and people making a difference in our community. This is KETV Newswatch 7's Chronicle.
Good morning to you, and thanks for joining us. I'm Bill Shammert. Did you know the United States faces lower life expectancy than peer nations and high rates of chronic conditions like obesity and diabetes? Well, October is Health Literacy Month. Health literacy refers to the ability of individuals to obtain, process, and understand basic health information and services in order to make informed decisions and take appropriate health actions for their health. Today on Chronicle, we'll hear from experts about what that really means, whether it's the importance of immunizations, breast cancer awareness. We've got you covered. And who better to speak to the health of Nebraskans than the director of the Douglas County Health Department, Dr. Lindsay Hughes. Dr. Hughes joins us now. So health literacy, what do you think people are illiterate at when it comes to their own health?
Honestly, chronic disease really rises to the top as something that a lot of people have issues with, but really don't have a lot of understanding around the best ways to treat or what their own behaviors can impact in terms of those diseases. And really just knowing how to move forward in a healthy way when they have one or multiple chronic diseases.
Narrowing the focus to Nebraska and us here in Douglas County, what are some of the biggest health problems that we're facing?
The health problems that we see here in Douglas County and in really the state of Nebraska are kind of the same ones that we've seen for quite some time. So heart disease still rises to the top as a major issue. Obesity and overweight and diabetes are all things that are still impacting Nebraskans and us here in Douglas County. Even it seems like we've been talking about those types of issues for a very long time, and we still are. Yes.
Yeah, no, DHHS has some data on that 11% of Nebraska adults have diabetes. A vast majority is type 2 diabetes. First, what's the difference between type 1 and type 2?
That's a great question. So type 1 is really a condition that is caused by your immune system. It's something we call an autoimmune disorder. And it happens when your pancreas is basically attacked by your immune system and your pancreas is not able to produce insulin. Insulin is what helps move sugar from your blood into your cells. That's one of your main energy sources to do everything that you do in life. And so it's very important to have that. Unfortunately, in type 1, you don't have the ability to make enough insulin to handle that load of sugar. Usually people are diagnosed with this early in life, and it's not something that you can do anything about. If you have type 1, there's really no way you're going to prevent that.
Right.
Type 2, on the other hand, is a little bit different in that you still produce that insulin, but your body doesn't use it very well. So it's almost like putting the wrong key into a lock. It just doesn't quite turn, it doesn't quite work right. It's really difficult for the insulin that's there to move that sugar into the cell. So ultimately, same problem. You have all of this buildup of glucose in the bloodstream. The difference here is that type 2 is largely preventable, not always, but largely can be prevented through things like great nutrition, physical exercise, stress management, and things like that.
You say it can be prevented. Can it be reversed?
It can go into what we would think of as remission. So somebody who has been diagnosed with type 2 diabetes can essentially reverse it by very, very strict diet control and exercise to get that blood sugar down essentially to like a normal level. But if they ever stop doing that, that type 2 diabetes is going to come back. So we prefer to think of it as more of a remission than a reversal.
You also talked about the obesity rate here in Nebraska, which I think is higher than a third, and it's been that way for a long time. What are the biggest issues stopping us from lowering that number?
It's interesting because obesity is something that is impacted by a lot of different things, and a lot of people think, well, you know, this is the fault of the person who maybe is experiencing the obesity. And it's true that behaviors like exercise and nutrition and stress management can have a positive impact on obesity, but we also have an environment that supports obesity. You know, eating highly ultra-processed foods is something It's much more common, it's cheaper, it's easier to get a hold of those types of foods, much more difficult to go home after a long day and prepare a meal fresh.
Right.
Some people also can't afford necessarily to get to and purchase fresh, healthy foods. And so other people, exercise can be a barrier for them because they can't afford a gym and maybe they don't know what they could do in their own homes to get some physical activity in. So there are kind of a constellation of things that impact obesity and have actually gotten worse. So we're more sedentary than we used to be. Our nutrition is worse than it used to be. And those are exactly the sorts of things that need to change in order to reverse our obesity trend in the United States.
A lot of people have pre-existing conditions. I'm going to use myself as an example. I have asthma. I've been diagnosed since I was a young kid, take an inhaler every day. Why is it important for somebody to be self-aware of what they may have?
Absolutely. So knowing what kinds of health conditions that you have or that you are at risk for developing is so important because that knowledge is power. You can take that knowledge and you can now either find medications that can slow down the progression of a disease or that can help. In your case, you may have an inhaler that you can use if you get into trouble when you're exercising or out in a really pollen heavy environment.
Out of Alice.
Exactly right,
yes.
exactly right. It also can help you to, for instance, I am a type 2 diabetic and I have a very long family history of that, but something that I have to be aware of is how my blood sugar is working on that particular day so that I can then go make healthier choices so that I live a longer and healthier life. And it's, you've got to know really what's going on with yourself and then know, okay, what do I do about it? And that is part of health literacy, is knowing your own status and then understanding what you can do to live healthier with whatever that is.
We only have about 30 seconds left, but to know you have a pre-existing condition, you have to visit a health practitioner, right?
Yes.
For people that are nervous or scared to go to the doctor, what would you tell them?
I would say make that appointment and go in. Our healthcare system is designed to help you, and really every doctor, every provider I have ever met is there to support and help and be a good partner in your health and to help you understand what's going on with your own body. So make that appointment.
Dr. Hughes, thank you so much for your time today.
Absolutely, thank you.
Now to a new life for Nebraska's drug take-back program. A lot of pharmacies have boxes for your expired and unused medications, then those drugs are safely destroyed. And for the near future, there's money to keep that program going. Chronicle's Aaron Hegarty reports.
State Senator Jana Hughes says learning Nebraska's everyday drug take-back program lost funding came as a shock.
Just not on my radar at all because we had appropriated money for it.
There's about $290,000 in this year's budget for a drug take-back program. But the governor's budget office and the Nebraska Department of Health and Human Services decided to discontinue funding. Earlier this month, the department told KETV it should be paid for by the pharmaceutical and healthcare industries, not taxpayers.
I think what's happening is departments are hearing we want to cut spending and they're looking at ways to do it. And so there might have been some miscommunication in HHS on it.
Now it will be funded. A spokesperson for Governor Jim Pillen tells KETV the reversal came following engagement with stakeholders and policymakers and will allow for further legislative consideration of this program. Amy Holman is the project manager with the Nebraska Pharmacists Association. She says when they lost the state funding, they also lost another $400,000 that require a match.
For a lot of people, because we've done it for 10 years, it's what they're used to doing with their leftover medications. They just know they can take it back to their pharmacies.
For those who've lost loved ones who are on a lot of medication, Holman says the Everyday Take-Back program is an easy option. And because of the risk of abuse or an accident, she says unused medications shouldn't stay around, but they shouldn't be flushed or tossed either,
so that they're not getting into our groundwater and soil.
She says a good way to keep that from happening is to make sure the program keeps running beyond next summer.
We'll definitely look into more funding sources or seeing if we can cut the budget on it some too.
That's Aaron Hegarty reporting. Next on KETV News Watch 7's Chronicle, a stark warning from the former director of the CDC. The real-world consequences, she says, are already affecting your health. That's next.